So when to visit an andrologist? If you are having an issue, probably to impregnate your partner if you are facing some difficulty. That means you are facing an issue with the male infertility. That is one area you can visit a andrologist. Or if there is an issue with the private parts, penis size concerns are there, so you can visit. Or if there is any phimosis, any issue is there, you can visit. Or it can be a paraphimosis, which is an emergency. You can visit an andrologist, and there is another entity called priapism, where there is a prolonged erection for more than 3 to 4 hours, which will be more painful. That is also an emergency priapism. Or it can be any genital trauma. If there is an injury to the penis or injury to the scrotum, so their coital injuries will be there. This is another area where you can visit a andrologist. Other concerns people will have most of the times related to the sexual issues, sexual aspects. If you are facing some issues with the masturbation or masturbation myths are there to sort it out, you can visit your andrologist. Or it can be erectile dysfunction, where you are facing in and getting erection as well as maintaining the erection. That is the area you can visit an andrologist. Or if you are having a very early ejaculation, fast ejaculation, what we call it is a premature ejaculation, you can visit. Or if your sexual desires are going down, what we call it is a hypoactive sexual desire disorder or low libido, that is one area you can visit. Or some people will face painful ejaculations. That what we call it is a odynorgasmia. Whenever you ejaculate, you feel some pain. That is another area you can visit an andrologist. Other things, if you are facing some issues with the testosterone hormone deficiency, that is a male hormone. If you are facing the deficiency symptoms where fatigue is there, you are not able to do the regular work. So as age progresses, testosterone hormone levels will go down. That what we call it is an andropause, like a female's menopause in case of males. Also, there is an entity called andropause. What we call scientifically, it is a late-onset hypogonadism. So that is one area where you can visit your andrologist. If you are facing issues with the sexually transmitted infections, unfortunately, unknowingly, if you have an exposure to any sexual act without protection or with protection, if you are having some concerns related to infection, so you can get elevated those issues with your andrologist. So in short, people who are having issues with the testicular pain, there is a chronic testicular pain, what we call chronic achalasia. That is another area where we can offer you microsurgical techniques after medication. If it is not working, we can do a microsurgical procedure. And people who have completed their families and they want to go ahead with the permanent sterilization, what we call it is a vasectomy, which is a simple procedure even when compared to the tubectomy. That is one procedure. No-scalpel vasectomy can be offered. And there are various advanced treatment modalities are there in andrology, where we can deal with the fertility related issues as well as the sexual problem related issues there, and even further late onset hypogonadism or testosterone deficiency. To sum up all these things, probably if you are facing with a fertility issue or sexual dysfunction, or it can be a testosterone hormone deficiency issues, or it can be related to testicular cancer or penile cancer, also your andrologist can evaluate further. So whenever you are facing these issues, you can consult an andrologist and take a opinion, and you can go accordingly. Thank you.